Hey there, expecting moms. Today, let's talk about something really important: ectopic pregnancy. This condition happens when a fertilized egg implants outside the uterus, usually in the fallopian tube. It's a serious situation that needs immediate attention, so let's dive into what you need to know. In a normal pregnancy, the fertilized egg travels down the fallopian tube to the uterus, where it implants and grows. But in an ectopic pregnancy, the egg implants in places it shouldn't, like the fallopian tube, ovary, or even the abdominal cavity. Why does this happen? Well, it could be due to tubal damage from conditions like pelvic inflammatory disease, previous ectopic pregnancies, or even surgeries on the fallopian tubes. Hormonal imbalances or congenital structural abnormalities can also play a role. What are the signs and symptoms? Ectopic pregnancies usually show up between the 4th and 12th week of pregnancy. You might experience sharp abdominal or pelvic pain on one side, vaginal bleeding that you might mistake for a period. Shoulder pain can also occur due to internal bleeding irritating the diaphragm. Dizziness or fainting could be signs of significant blood loss. And of course, you'll likely miss your period. How do doctors diagnose it? They use several methods. A transvaginal ultrasound is the gold standard for spotting an ectopic pregnancy. Blood tests for HCG levels can also give clues, as these levels rise more slowly than in a normal pregnancy. Lastly, a pelvic exam can reveal tenderness or a mass in the pelvic region. So, what are the treatment options? The approach depends on many factors like the size and location of the pregnancy and whether the tube has ruptured. For medical management, methotrexate can be used in early, unruptured ectopic pregnancies. This medication stops the growth of the ectopic tissue. However, it requires close follow-up. Surgical options include laparoscopy, which is common if the pregnancy is advanced or the tube has ruptured. In severe cases, the entire fallopian tube may need to be removed. Sometimes a smaller incision can remove the ectopic tissue while preserving the tube. In very rare cases, expectant management might be an option, where the pregnancy resolves on its own with close monitoring. But this is not common and should only be done under strict medical supervision. Complications can be severe, like tubal rupture leading to massive internal bleeding. This requires emergency surgery. There's also the risk of infertility and higher chances of future ectopic pregnancies. Let's take a real-life example. A 30-year-old woman with a history of pelvic inflammatory disease comes to the emergency room with severe lower abdominal pain on one side, light vaginal spotting, and dizziness. She hasn't had her period in 6 weeks. An ultrasound doesn't show an intrauterine pregnancy, but reveals a mass and fluid in the pelvis. Her HCG levels are lower than expected. She undergoes emergency surgery, and a ruptured fallopian tube is removed. Afterwards, she's counseled on risks for future pregnancies and the importance of early prenatal care. To wrap up, ectopic pregnancy is a life-threatening condition that needs quick diagnosis and treatment. If you have risk factors like previous ectopic pregnancies or tubal surgery, stay vigilant. Early diagnosis and appropriate treatment are crucial for your safety and well-being. Thanks for watching and take care of yourselves.